Introduction to Medical Spanish. Effective communication is paramount in healthcare, directly impacting patients' safety and treatment outcomes. For healthcare professionals in diverse communities, proficiency in medical Spanish is increasingly vital. This course provides the linguistic tools and cultural understanding necessary to bridge communication gaps with Spanish-speaking patients. It aims to empower practitioners to deliver equitable and high-quality care to all individuals, fostering trust and improving health equity. Understanding basic Spanish medical terminology and conversational phrases can significantly enhance patient interactions. It allows for more accurate information gathering, better explanation of conditions, and clearer instructions for care. This foundational knowledge also demonstrates respect for patients' cultural backgrounds and linguistic preferences, which is crucial for building rapport and ensuring patient comfort. The diploma will cover a wide range of topics, from basic greetings to complex medical scenarios. Basic greetings and introductions. Initiating patient interactions with appropriate greetings sets a positive tone and builds immediate rapport. Learning fundamental Spanish greetings like hola, hello, buenos dias, good morning, buenas tardes, good afternoon, and buenas noches, good evening, is essential. These simple phrases show respect and create a welcoming environment for Spanish-speaking patients. Always remember to use formal address when speaking to patients, employing usted instead of tú to convey professionalism and deference. After a greeting, introducing yourself and your role is the next crucial step. Phrases such as me llamo, your name, my name is your name, and soy, your role, I am your role, are fundamental. For example, soy enfermero, I am a nurse, or soy doctor, I am a doctor. Following this, asking ¿Cómo está usted? How are you? Demonstrates genuine concern for the patient's well-being. These initial exchanges lay the groundwork for effective communication throughout the medical consultation. Patient demographics and personal information. Gathering accurate demographic and personal information is a critical first step in patient registration and care. Key questions include: ¿Cuál es su nombre completo? What is your full name? ¿Cuál es su fecha de nacimiento? What is your date of birth? And ¿Cuál es su dirección? What is your address? Understanding these basic inquiries ensures proper identification and record keeping. It is also important to ask about preferred language, ¿Cuál es su idioma preferido?, to ensure ongoing effective communication. Other essential pieces of information often include: ¿Cuál es su número de teléfono? What is your phone number? And ¿Tienes seguro médico? Do you have health insurance? When asking about marital status, ¿Es usted casado a o soltero a? Are you married or single? Can be relevant. Always speak clearly and patiently, allowing time for the patient to understand and respond. Confirming information by repeating it back can prevent misunderstandings and ensure accuracy in medical records. Understanding common symptoms. Accurately identifying and describing symptoms is fundamental to diagnosis and treatment. Healthcare professionals must be able to ask about common symptoms using clear Spanish phrases. Questions like, ¿Qué le trae por aquí hoy? What brings you here today? Or, ¿Cuáles son sus síntomas principales? What are your main symptoms? Are crucial starting points. It is important to encourage patients to describe their symptoms in their own words, providing specific details about onset, duration, and severity. Key symptom vocabulary includes dolor, pain, fiebre, fever, tos, cough, fatigue, náuseas, nausea, and mareos, dizziness. Asking, ¿Desde cuándo tiene estos síntomas? Since when have you had these symptoms? Helps establish the timeline. Further questions like, ¿Ha tomado algo para el dolor? Have you taken anything for the pain? provide context for their current condition. Understanding these terms and questions enables a thorough symptom assessment. Describing pain and discomfort. Pain is a subjective experience, and healthcare professionals need precise language to understand its characteristics. Asking ¿Dónde le duele? Where does it hurt? Is the initial step to localize the pain. Further questions like ¿Cómo describiría el dolor? How would you describe the pain? Help elicit details about its nature. Patients might describe pain as agudo, sharp, sordo, dull, pulsátil, or quemante, burning. Understanding these descriptors is crucial for accurate assessment. Quantifying pain is also vital, often using a pain scale. Asking del 1 al 10, ¿Cuánto le duele? From 1 to 10, how much does it hurt? Provides a numerical value. Inquiring about factors that worsen or alleviate pain, such as ¿Qué empeora el dolor? What makes the pain worse? And ¿Qué alivia el dolor? What relieves the pain? Offers valuable diagnostic clues. These detailed questions enable a comprehensive understanding of the patient's discomfort and guide appropriate interventions. Body parts and anatomy. Knowledge of Spanish terms for body parts is indispensable for both understanding patient complaints and providing clear instructions. Starting with major body regions, such as cabeza, head, cuello, neck, pecho, chest, abdomen, and espalda, back, is foundational. Patients often use these terms to indicate where they are experiencing symptoms. Being able to accurately identify these areas facilitates precise communication during examinations. Moving to limbs and extremities, brazo, arm, mano, hand, pierna, leg, and pie, foot, are essential. Internal organs also have specific terms, though often more complex, like corazón, heart, pulmones, lungs, estómago, stomach, and hígado, liver. Using visual aids, such as anatomical charts, can greatly assist in clarifying these terms with patients. Reinforcing this vocabulary ensures that both the healthcare professional and the patient are referring to the same anatomical location. Medical history taking. A thorough medical history is the cornerstone of effective patient care, providing crucial context for current symptoms. Essential questions include: ¿Tiene alguna condición médica crónica? Do you have any chronic medical conditions? And ¿Ha tenido alguna cirugía en el pasado? Have you had any surgeries in the past? Inquiring about family history. ¿Hay alguna enfermedad en su familia? Is there any illness in your family? Can reveal genetic predispositions. This comprehensive approach ensures all relevant health information is collected. Further questions should cover lifestyle factors such as ¿Fuma o bebe alcohol? Do you smoke or drink alcohol? And ¿Hace ejercicio regularmente? Do you exercise regularly? It is also important to ask about current medications. ¿Está tomando algún medicamento actualmente? Are you currently taking any medication? And allergies. ¿Tiene alguna alergia? Do you have any allergies? Documenting this information accurately in Spanish is vital for continuity of care and preventing adverse events. Clear communication during history taking builds patient trust and ensures a complete clinical picture. Physical examination vocabulary. Conducting a physical examination requires clear communication to guide the patient through each step. Phrases like por favor, siéntese aquí, please sit here, or acuéstese, por favor, please lie down, are essential instructions. Explaining actions such as voy a escuchar su corazón, I am going to listen to your heart, or voy a tomarle la presión arterial, I am going to take your blood pressure, helps alleviate patient anxiety and ensures cooperation. Transparency throughout the examination builds trust. Specific instructions for patient actions are also critical. For example, respire hondo, breathe deeply. Tosa por favor, cough please, or mire hacia arriba, look up, are common directives. Describing what you are doing, such as voy a palpar su abdomen, I am going to palpate your abdomen, keeps the patient informed. Mastering this vocabulary ensures a smooth and effective physical examination, allowing the healthcare professional to gather necessary clinical information accurately. Asking about medications and allergies. Obtaining a comprehensive list of medications and known allergies is crucial for patient safety and effective treatment planning. Key questions include: ¿Qué medicamentos está tomando actualmente? What medications are you currently taking? And ¿Puede decirme los nombres de los medicamentos? Can you tell me the names of the medications? It is important to ask about both prescription and over-the-counter drugs, as well as any herbal supplements. This detailed inquiry helps prevent adverse drug interactions. Regarding allergies, asking, ¿Tiene alguna alergia a medicamentos, alimentos o al ambiente? Do you have any allergies to medications, foods, or the environment? Is vital. If the patient reports an allergy, further questions like, ¿Qué tipo de reacción tiene? What type of reaction do you have? Are necessary to understand the severity and nature of the allergic response. Documenting this information clearly and accurately in Spanish is a non-negotiable aspect of patient care, ensuring all providers are aware of potential risks. Discussing chronic conditions. Managing chronic conditions effectively requires ongoing communication and patient education. Initiating discussions with ¿Tiene alguna condición crónica como diabetes o hipertensión? Do you have any chronic conditions like diabetes or hypertension? Is a common starting point. Understanding the patient's current management. ¿Cómo está manejando su condición? How are you managing your condition? Provides insight into their adherence and understanding of their treatment plan. This helps tailor advice and support to their specific needs. Further questions should explore the impact of the condition on their daily life, such as, ¿Cómo afecta esta condición su vida diaria? How does this condition affect your daily life? It is also important to discuss any recent changes or concerns. ¿Ha notado algún cambio en sus síntomas últimamente? Have you noticed any changes in your symptoms lately? Providing clear, concise information about the condition and its management in Spanish empowers patients to take an active role in their health. Empathy and patience are key when discussing these long-term health challenges. Emergency situations and phrases. In emergency situations, rapid and clear communication is paramount. Healthcare professionals must be able to quickly ascertain the nature of the emergency. Essential questions include ¿Qué pasó? What happened? And ¿Necesita ayuda inmediata? Do you need immediate help? Directing patients or bystanders with phrases like llame al 911, call 911, or mantenga la calma, stay calm, can be critical in chaotic moments. Every second counts, so clarity and conciseness are vital. Specific emergency phrases are also crucial for guiding interventions. For example, está sangrando mucho. He/she is bleeding heavily. No puede respirar. He/she cannot breathe. Or está inconsciente. He/she is unconscious. Describe critical conditions. Instructing no se mueva, don't move, or abra la boca, open your mouth, can facilitate immediate care. Practicing these phrases ensures that healthcare providers can act decisively and effectively, even under high-stress circumstances, potentially saving lives. Hospital departments and staff. Navigating a hospital can be daunting for patients, especially those with language barriers. Knowing the names of different hospital departments in Spanish is essential for directing patients and explaining where they need to go. Common departments include Sala de Emergencias, Emergency Room, Unidad de Cuidados Intensivos, UCE, Intensive Care Unit, ICU, Cirugía, Surgery, and Radiología, Radiology. Providing clear directions helps reduce patient confusion and stress. Identifying various hospital staff members in Spanish is also important for patient understanding and trust. Roles such as médico, doctor, enfermero, nurse, técnico, receptionist, and receptionist are frequently encountered. Explaining who will be providing care, la, doctor, le verá pronto. The doctor will see you soon, helps manage patient expectations. This vocabulary facilitates smoother patient flow and a more comfortable hospital experience. Explaining diagnoses. Communicating a diagnosis to a patient requires clarity, empathy, and appropriate language. Starting with su diagnóstico es, your diagnosis is, o hemos encontrado que tiene, we have found that you have, provides a direct statement. It is crucial to use simple, understandable terms, avoiding overly technical medical jargon where possible. For example, instead of hipertensión arterial, one might say presión arterial alta, high blood pressure. After stating the diagnosis, it is important to explain what it means in practical terms. Questions like, ¿Tiene alguna pregunta sobre esto? Do you have any questions about this? Encourage patient engagement and ensure comprehension. Providing a brief, clear explanation of the condition. Esto significa que, this means that, helps patients process the information. Patience and a willingness to repeat or rephrase information are essential to ensure the patient fully grasps their diagnosis and its implications for their health. Treatment plans and procedures. Once a diagnosis is made, explaining the proposed treatment plan and any necessary procedures is the next critical step. Phrases like nuestro plan de tratamiento es, our treatment plan is, or vamos a necesitar hacer un procedimiento, we will need to do a procedure, introduce the next steps, clearly outlining the purpose of the treatment. Esto es para ayudarle a, this is to help you, helps patients understand the rationale behind the recommendations. Transparency builds trust and encourages adherence. Detailed instructions for medications. Tome este medicamento número veces al día. Take this medication number times a day. Or for lifestyle changes, es importante que descanse. It is important that you rest, are essential. When discussing procedures, explaining what to expect, sentirá un poco de presión. You will feel a little pressure, helps prepare the patient. Always ask, ¿Tiene alguna pregunta sobre el tratamiento? Do you have any questions about the treatment? To ensure full comprehension and address any concerns, clear step-by-step communication is vital for successful outcomes. Preoperative and postoperative instructions. Providing clear preoperative instructions is critical for patient safety and successful surgical outcomes. Phrases like, no coma ni beba nada después de la medianoche, do not eat or drink anything after midnight, are non-negotiable. Explaining the importance of these instructions, esto es para su seguridad, this is for your safety, helps ensure patient adherence. Detailing what to bring to the hospital, traiga su identificación y su lista de medicamentos. Bring your ID and your medication list. Prepares them for admission. Post-operative care instructions are equally vital for recovery and preventing complications. Common directives include descanse mucho, rest a lot, tome sus medicamentos como se le indicó, take your medications as directed, and mantenga la incisión limpia y seca, keep the incision clean and dry. Explaining potential symptoms to watch for. Llame si tiene fiebre o dolor intenso. Call if you have a fever or severe pain. Empowers patients to seek help when needed. Clear, written instructions in Spanish, reinforced verbally, are highly beneficial. Nutrition and dietary restrictions. Discussing nutrition and dietary restrictions is often a crucial part of patient education and disease management. Asking, ¿Tiene alguna restricción dietética o alergia alimentaria? Do you have any dietary restrictions or food allergies? Is a primary question. Understanding a patient's eating habits. ¿Qué suele comer en un día normal? "What do you usually eat on a normal day?" provides valuable context for personalized advice. This helps healthcare professionals tailor dietary recommendations effectively. Providing clear guidance on healthy eating or specific dietary needs is essential. Phrases like, "Es importante que coma muchas frutas y verduras," "It is important that you eat many fruits and vegetables," or "Evite los alimentos con alto contenido de azúcar," "Avoid foods high in sugar," offer actionable advice. For patients with conditions like diabetes, explaining "Controle su consumo de carbohidratos," "Control your carbohydrate intake," is vital. Using visual aids, such as food pyramids or plate diagrams, can enhance comprehension and reinforce healthy eating messages in Spanish. Maternity and pediatrics. Communicating effectively in maternity and pediatric settings requires sensitivity and specialized vocabulary. For expectant mothers, questions like, "¿Cuántas semanas de embarazo tiene?" "How many weeks pregnant are you?" and "¿Siente al bebé moverse?" "Do you feel the baby move?" are fundamental. Explaining prenatal care. "Es importante que venga a sus citas prenatales." "It is important that you come to your prenatal appointments." Ensures healthy pregnancies. Using gentle and reassuring language is crucial in these sensitive areas. In pediatrics, addressing parents and children with appropriate language is key. Asking parents, "¿Cuándo empezó la fiebre del niño A?" "When did the child's fever start?" or "¿Ha comido bien el niño A?" "Has the child eaten well?" gathers vital information. When speaking to children, using simple words and a friendly tone, "Vamos a revisar su garganta," "We are going to check your throat," helps reduce anxiety. Building trust with both the child and the parents is essential for effective pediatric care. Mental health terminology. Discussing mental health requires particular sensitivity and a clear understanding of specialized Spanish terminology. Initiating conversations with "¿Cómo se siente emocionalmente?" "How are you feeling emotionally?" or "¿Ha estado sintiendo tristeza o ansiedad?" "Have you been feeling sadness or anxiety?" opens the door to these important topics. It is crucial to create a safe and non-judgmental space for patients to express themselves. Using empathetic language helps build rapport and encourages openness. Key mental health terms include depresión, depression, ansiedad, anxiety, estrés, and salud mental, mental health. Asking about support systems. ¿Tiene alguien con quien hablar? Do you have someone to talk to? Or coping mechanisms. ¿Qué hace para manejar el estrés? What do you do to manage stress? Provides valuable insight. Explaining available resources. Podemos ofrecerle apoyo y recursos. We can offer you support and resources. Reassures patients that help is available. Cultural considerations are especially important in mental health discussions, as stigma can vary significantly. Pharmacy and prescriptions. Effective communication at the pharmacy is essential for medication adherence and patient safety. Healthcare professionals should be able to explain prescriptions clearly. Phrases like, "Esta es una receta para su medicamento." "This is a prescription for your medication." Or, "Tome una pastilla número veces al día." "Take one pill, number times a day," are fundamental. Ensuring the patient understands the dosage, frequency, and duration is paramount to prevent errors. Further instructions regarding medication administration. Tómelo con comida. Take it with food, or no lo tome con alcohol. Do not take it with alcohol, are also critical. Explaining potential side effects. Puede sentir un poco de mareo. You might feel a little dizzy. Prepares the patient for what to expect. Always ask, ¿Tiene alguna pregunta sobre cómo tomar este medicamento? Do you have any questions about how to take this medication? To confirm understanding. Clear communication at this stage significantly impacts treatment efficacy and patient well-being. Scheduling appointments and follow-ups. Efficient scheduling of appointments and follow-ups is crucial for continuity of care. Healthcare professionals need to communicate appointment details clearly in Spanish. Phrases like necesitamos programar una cita de seguimiento, we need to schedule a follow-up appointment, are common. Asking about availability, ¿qué día y hora le viene mejor? What day and time works best for you? Helps accommodate patient preferences. Confirming the date and time, su cita es el date a las time, prevents misunderstandings. Providing all necessary information for the appointment, such as venga en ayunas, come on an empty stomach, or traiga sus resultados de laboratorio, bring your lab results, ensures the patient is prepared. Explaining the importance of follow-up, es importante para su recuperación, it is important for your recovery, reinforces adherence. Offering a reminder, le enviaremos un recordatorio, we will send you a reminder, adds an extra layer of support. Clear communication in scheduling ensures patients receive timely and appropriate care. Cultural competency in healthcare. Cultural competency is fundamental to providing respectful and effective care to diverse patient populations. Understanding that cultural beliefs can significantly influence health perceptions, illness behaviors, and treatment preferences is crucial. Healthcare professionals must recognize and respect varying communication styles, family dynamics, and traditional health practices among Spanish-speaking communities. This awareness helps avoid misunderstandings and builds stronger patient-provider relationships. Developing cultural competency involves more than just language proficiency. It requires an open mind and a willingness to learn about different cultural perspectives. Asking open-ended questions like, ¿hay algo en su cultura o creencias que deba saber sobre su atención médica? Is there anything in your culture or beliefs that I should know about your medical care? Demonstrates respect and invites dialogue. Adapting care plans to align with cultural values, when medically appropriate, can significantly improve patient satisfaction and adherence. Continuous learning about cultural nuances is an ongoing process for all healthcare providers. Ethical considerations and patient rights. Ethical considerations and patient rights are cornerstones of healthcare practice, requiring clear communication regardless of language. Healthcare professionals must ensure patients understand a right to informed consent. Explaining, tiene derecho a saber sobre su condición y tratamiento, you have the right to know about your condition and treatment, is fundamental. Ensuring privacy and confidentiality. Su información médica es confidencial. Your medical information is confidential, builds trust. These principles are universal and must be upheld for all patients. Patients also have the right to refuse treatment. Tiene derecho a rechazar el tratamiento. You have the right to refuse treatment and to receive a second opinion. It is crucial to respect patient autonomy and preferences, even when language barriers exist. Using an authorized medical interpreter, rather than family members, for complex discussions helps maintain ethical standards and accuracy. Upholding these rights and ethical principles in Spanish ensures equitable and respectful care for every individual, fostering a patient-centered approach. Common medical abbreviations. While medical abbreviations are primarily for written documentation, healthcare professionals may encounter them in discussions or when reviewing patient charts. Understanding common Spanish medical abbreviations can be beneficial, though it is always best to use full terms when speaking with patients to avoid confusion. For example, CS might stand for con síntomas, with symptoms, and SS for sin síntomas, without symptoms. Recognizing these can aid in quick comprehension of notes. Other frequently used abbreviations include DX for diagnóstico, diagnosis, TX for tratamiento, treatment, and HX for historia, history. While these are often similar to English abbreviations, Knowing their Spanish equivalents is important for accurate record interpretation. When communicating with patients, always translate abbreviations into clear, full Spanish words. The goal is to enhance clarity, not to introduce new jargon, ensuring that patients fully understand their care plan and medical information. Telehealth and virtual consultations. Telehealth and virtual consultations have become increasingly prevalent, requiring specific communication strategies, especially with Spanish-speaking patients. Ensuring patients understand how to connect. Necesitamos hacer una videollamada. We need to do a video call. And what technology is needed. Necesitará un teléfono inteligente o una computadora. You will need a smartphone or a computer is crucial. Explaining the virtual nature of the visit. La consulta será por video. The consultation will be by video. Sets expectations. This allows for accessible care delivery. During a virtual consultation, clear verbal instructions are even more critical since physical cues may be limited. Phrases like, ¿Puede mostrarme dónde le duele? Can you show me where it hurts? Or ¿Puede mover su brazo así? Can you move your arm like this? Are important for assessment. Confirming audio and video quality, ¿Me escucha y me ve bien? Do you hear and see me well? Ensures effective communication. Telehealth expands access to care, but success relies heavily on clear, patient-centered communication in Spanish. Advanced medical Spanish scenarios. Moving beyond basic interactions, advanced medical Spanish scenarios involve more complex discussions, such as end-of-life care, genetic counseling, or explaining intricate surgical procedures. These situations demand a high level of linguistic precision and cultural sensitivity. Phrases like necesitamos hablar sobre sus deseos para el final de la vida. We need to talk about your end-of-life wishes require careful and empathetic delivery. Understanding nuanced vocabulary related to prognosis and difficult decisions is critical. In these advanced scenarios, the ability to explain complex medical concepts clearly, using analogies or simplified terms when appropriate, is paramount. For example, discussing genetic risks might involve explaining probabilities and inheritance patterns. The healthcare professional must be prepared to answer difficult questions and address emotional responses with compassion. Utilizing an accredited medical interpreter for these sensitive conversations is often recommended to ensure complete accuracy and support for the patient and family. Continuous practice and immersion are key to mastering these challenging interactions. Review and continued learning. This diploma course has provided a robust foundation in Spanish for healthcare professionals, covering essential vocabulary, phrases, and cultural considerations. Reviewing key concepts regularly is crucial for retention and fluency. Practicing conversational Spanish with colleagues, utilizing flashcards for medical terminology, and engaging with Spanish-language medical resources are excellent ways to reinforce learning. Consistent exposure and active recall are vital for long-term proficiency. Continued learning is an ongoing journey in language acquisition, especially in a dynamic field like healthcare. Staying updated with new medical terminology, participating in advanced Spanish courses, or seeking opportunities for immersion in Spanish-speaking communities will further enhance your skills. The goal is not just to pass a course, but to achieve a level of comfort and competence that allows for seamless, empathetic communication with all patients. Your commitment to continued learning will directly translate into improved patient care and professional growth.